Thanks for joining us. My name's JT and we're at the Neurological Care Center here in Montgomery, conveniently located next to Jackson Hospital, and we're talking with Dr. Rosa Bell. Dr. Bell, thanks for joining us.
Thank you for having me, JT.
Yeah, we're excited to get a little insight as to the different services and procedures that you offer here at the Neurological Care Center. I can tell you from firsthand experience that there are some world-class procedures that are happening right here in Montgomery with Dr. Rosa Bell, and we're going to dive into more detail on that here in just a few minutes. But before we do that, let's talk a little bit about you and your qualifications and your background, how you got to where you are today.
Sure. I'm a board-certified neurologist. I did my undergraduate and my medical school training at the University of Tennessee. I did my internal medicine at Kettering Medical Center, and I went on to do a neurology residency at the University of Cincinnati, and I went on to do a clinical neurophysiology fellowship at the University of Cincinnati and Children's.
You know, it's just amazing, your wide range of background and experiences, and I've seen so many people and patients that have come in here who have neurological issues and have, gone other places or tried to get into Birmingham and other places around the state and have not had the services provided to them to find a proper diagnosis. So let's talk about some of the different procedures that you offer here that are unique for you.
Sure. I'm boarded in both general neurology and clinical neurophysiology. So therefore, we're able to treat all neurological conditions. One of my subspecialties is epilepsy. So we have the prolonged video ambulatory EEG, where we can assess the brain waves. We can also evaluate the patient for not just seizures, but other type of symptoms like syncope, blackouts, altered mental status with headaches, to help determine what is wrong neurologically and treat them and get them better.
Well, I tell you, the video ambulatory EEG is one of the procedures that we're going to be getting more details on in just a little bit. And if you suffer from any of those conditions that you heard Dr. Bell talk about, you need to contact her office. It's real simple. You can call 262-1113 or talk to your referring physician about being treated at the Neurological Care Center. We're going to take a break and be right back. We've got a whole lot more and some exciting information for anybody, either yourself or somebody in your family or circle of friends that has struggled with neurological issues or seizures or migraines. Great information coming up here in just a moment.
Hi, I'm Dr. Rosa Bell, a board-certified neurologist specializing in the treatment of migraines, seizures, epilepsy, neuromuscular disorders, as well as general neurological disorders.
Hi, my name is Alasia Taylor, and I've been seeing Dr. Bell for the past 5 years now. I've had serious migraine issues, and since seeing her, I've found relief.
No need to suffer with migraines. Call Dr. Rosa Bell for an appointment today at 262-1113, conveniently located across from Jackson Hospital.
I first met James in 5th grade. We got married and had twin boys. But then, one night, a truck didn't stop. But thanks to our Forester, neither did our story. And that's why we'll always drive a Subaru.
During the Subaru True Love event, get financing as low as 0% for 48 months at Montgomery Subaru.
Welcome back. We are with Dr. Bell from the Neurological Care Center. And as a parent, what are some of the early signs that we should be looking for with neurological issues or seizures in teenagers?
Sure. With teenagers and even younger children, you want to look at episodes of staring. You also want to look at change in behavior, because there's a lot more that we've learned about seizures in children and teenagers where it's not what the dogma was previously. So we've learned things like limbic encephalitis, which teenagers very often will present with altered mental status, confusion, and you will not see anything that suggests what we typically call seizures, like jerking episodes or anything like that.
So it's not like, falling out on the floor or anything like that. It could be very, very subtle.
Very subtle.
How do you, what do you specifically, I guess there isn't a specific way to look for, but I mean, as staring, how long?
Well, if you're talking to your teenager or your child and you notice that they stare off and this repetitively happens, and you know it's not just that they're ignoring you, that you know that they really do not recall what was happening at that moment, or one of the major things is making sure that it's repetitively happening. If that's a stereotype behavior, you should become concerned.
And listen to that mom gut instinct if you know something's not right.
And that's a very good point, Leanne. Very often the mother or also the teenager will know something's different. This is not how I normally am.
Exactly. And you know, a lot of times if your primary doctor doesn't understand, you know, as a parent you have to keep asking, well, who do I need to go see? Who do I need to go see? What specialist can I go see? You know, and migraines. I suffer from migraines. Both of my daughters have migraines, and they've got very different side effects from migraines. One has slurred speech, which is really scary, especially the first time it happened, and then my other daughter gets physically ill, and I do too. And the light hurts, the sound hurts, everything hurts, and they're debilitating.
They are, and that's a very good point. Migraines are not just headaches. They can be very debilitating, but there are treatments, and patients do get better with the treatments.
Now, people can come and see you for migraines. I never would have thought of coming and seeing a neurological doctor for migraines.
Yes, you should come see a neurologist, because the first and foremost you want to determine if they are migraines. Wow. Because they could be ominous signs of something else.
And sometimes it just feels like you just can't think. They're really, really scary. They really are. And I am glad that we're doing this, because the whole point is to educate everybody.
Exactly.
Absolutely. So now we have a viewer question from your website asking about strokes. And after someone has a stroke, what kind of options do they have for recovery?
Well, it's based on the type of stroke, but even prior to having the stroke, people need to know the signs of stroke. If you're having weakness of one side of the body, slurred speech that persists, you should go to the ER, because now we can reverse strokes.
Wow.
If you get there within the 3-hour window, we can use a drug called TPA, and it can actually reverse stroke. So this is very important that people know. If you persistently have a deficit where you're weak, you know what you want to say but can't say it, confusion, if it's anything that you would rather err on the side of caution and go, because it could prevent you from having a debilitating sequela after that. But after stroke has occurred, the main thing is to determine what caused it.
Right.
What's the source, so we do a workup to determine, so that we can prevent any more strokes from occurring.
Now I know that in the cases of a heart attack, women have different symptoms. Do women have different symptoms than men in a stroke?
Not necessarily. It's based on where the stroke is occurring in the brain.
Wow, that's good to know. I didn't know that. So we are really excited to talk about this next procedure, the video ambulatory EEG. This is something that is truly revolutionary, and you need to hear about it, so stay tuned.
The number one thing that makes Smile Makers different from other dental offices is just the relationships we form with our patients, and we really care about our patients.
I think listening is critical. It's not what I want for them, it's what they want for themselves.
And our vision is to be a practice where patients can come and have all of their dental needs taken care of in one location.
Many people take care of teeth, but we want to take care of patients.
Hi, I'm Dr. Rosa Bell. I'm excited to introduce FiberTorch, an apple cider vinegar-based health supplement that promotes body alkalinity, GI motility, and weight loss. FiberTorch is an easy-to-use, once-a-day supplement. 1 tablespoon followed by 8 ounces of water. In order to obtain FiberTorch, go to our website at www.fibertorch.com or our conveniently located office at 1315 Mulberry Street.
What if you really could have it all?
At Exit Realty,
we believe
the home you want
is right there.
Right there.
and we'll help you find it.
You can count on us.
And you thought we just sold real estate.
We are Exit Realty. Think smart,
Think Exit.
Welcome back, and thanks for joining us. It's JT, and we're talking with Dr. Rosa from the Neurological Care Center in Montgomery, conveniently located next to Jackson Hospital. You've learned a little bit about some of the different neurological treatments they have available here, but the one I'm really excited about, and the one that I've done a little bit of homework on, is the video ambulatory EEG procedure, because Dr. Bell, it really is revolutionary, and the way that your office handles this procedure is a little bit different than other places in town. We're going to talk about that here in just a few minutes, but first and foremost, before we talk about what it is, who is video ambulatory EEG for?
Video ambulatory EEG is for anyone who's having periods of altered mental status, blackouts, epilepsy, seizures, migraine headaches with altered mental status. So any time that there's any change in mental status, the video ambulatory EEG may be applicable.
Absolutely, and it is a world-class procedure, again, that's offered right here at Neurological Care Center. Let's talk about some of the benefits and convenience of this procedure.
Well, this procedure is very, very beneficial and also cost-effective. When I started initially doing this procedure to offer it to my patients, one of the reasons was because it was taking 3 to 6 months to get to a university setting where a similar procedure is done.
Wow.
To University of Alabama, Birmingham, or to University of South Alabama. Also, this procedure is much cheaper than the thousands of dollars that is paid when you're in the inpatient setting. Also, now the newer studies have shown that patients are more likely to have their typical events when they're in their home environment.
Exactly. So when we say video ambulatory EEG, this truly is in the patient's home, the comfort of their own home. Like you said, they're avoiding a 3 or 4 day hospital stay, and the things that are going to trigger what we're looking for are going to probably most likely happen in their home environment.
Exactly. And the system that we have perfected, it is very, very cutting edge. We can view the patient in real time. The tech can also remote into the patient, speak to the patient, timestamp any events that have occurred.
And this leads to proper diagnosis and treatment.
Exactly.
Wow.
Exactly.
It really is an awesome procedure, and we're going to take a short look at a video that was recently produced that demonstrates the portability and the fact that the video ambulatory EEG can literally happen anywhere, anytime, and be observed by the techs right here at the Neurological Care Center. And this is actually a real-life situation, the wide world of sports. Check this out.
Hi, I'm Dr. Rosa, a board-certified neurologist, clinical neurophysiologist, and epileptologist. We are showing you an unprecedented process of viewing and assessing brain waves in real time and speaking with both the person that brain waves are being assessed and the technician that placed the electrode cap. We can do this after head trauma and assess after concussions objectively in real time. Prior to this, we have no way objectively to assess what is going on with the brain after head trauma. The electrode cap has been placed. We can now send these brain waves remotely, and they can be viewed anywhere in the world on any type of handheld or computer device. Now I'm about to step out, and it will be several hundreds of feet away so that we can demonstrate how you can be anywhere in the world and view these brain waves and assessing to see if I see any abnormalities in real time. Now we are in a remote location, and we are viewing the patient or the subject remotely, and I am talking to the technician and the person that is having the brainwaves assessed in real time. Okay, here are the brainwaves, which we can minimize and look at everything that we need to look at. Now we're going to minimize, and I can still see the person obtaining the brainwaves very clearly, and if need be, they can see me. Okay, could you please have her close her eyes?
Will you close your eyes for me, please?
Now I'm looking at reactivity of the brain to the eye closure. which very often after a concussion, we will see changes that suggest that the brain has been stunned. Could you have her open her eyes?
Will you open your eyes for me, please?
I'm now seeing changes in the brain wave that if there were abnormalities, I could see at this time. Now I want to see just not only her brain waves, but how well she is reacting to command. Could you have her hold up 2 fingers?
Will you hold up 2 fingers, please? Thank you.
Could you have her repeat, no ifs, ands, or buts?
Repeat this after me. No ifs, ands, or buts.
No ifs, ands, or buts.
So this is in real time. Also, we have an EKG lead here where we're looking at the patient's heart rate. So if there's an arrhythmia that is contributing to any type of mental status change that has just occurred, we can also see that in real time. I'm so excited that you have seen this unprecedented technology where we can assess brain waves in real time in any area of the world or United States, and that we can assess objective data on a player's brain function. I have worked over 3 years to perfect this system to monitor the brain waves remotely in real time. We can also save this data, and we can also upload the data in real time to the cloud for later viewing.
So I think it's easy to see how remote this procedure is and how connected even you are with the patient at all times.
Exactly, and we can read the study, view the study anywhere. And this is actually global because we can read it anywhere in the world.
Absolutely incredible. So if our viewers right now, either themselves or somebody in their circle of friends or family, suffers from any of those conditions we talked about, where they might be a great candidate for the video ambulatory EEG, how do they get referred to the Neurological Care Center?
They can call my friendly staff at 334-262-1113. If they need a referral, my staff will help them with getting that referral from their doctor.
Excellent. You can also check out the website clinicalneuro.net right there on your screen for more information on the video ambulatory EEG procedure. We've got a lot more coming up, exciting information to keep you healthy and keep you operating at peak performance in your life at the Neurological Care Center in Montgomery. We'll be right back.
Discover your next bargain at Prattville Pickers.
This massive 100,000 square foot indoor destination is home to over 300 dealers. Items you won't find in the big box stores.
Interested in becoming a vendor? Contact us at 730-0266. Prattville Pickers is open 7 days a week at 616 Highway 82 West, across from Prattville Country Club. Whether you're a picker, junker, or vintage hunter.
Visit shopprattvillepickers.com.
Hi, I'm Dr. Rosa Bell, a board-certified neurologist here at the Neuro Care Center. We're doing the prolonged ambulatory video EEG. If you're having symptoms of fainting, blackouts, change in mental status, memory loss, or seizures, this 72-hour study that monitors your brain waves in the comfort of your own home will be helpful in your diagnoses. Ask your referring physician or call us.
Rock and Jump is Montgomery's ultimate trampoline park.
Featuring a large open jump area, do battle with your friends at X-Beam, a slam dunk zone where you can dunk like a pro, a huge rock climbing tower, trampoline dodgeball, and much more.
It really is fun for all ages. Parents, too. Don't miss fun events like Rockin' Fridays and even Rockin' Birthday Parties. Parents, enjoy the lounge with TVs and massage chairs and the Rockin' Cafe when you work up an appetite.
Rock and Jump, now open across from Eastdale Mall.
So wow, very interesting about the video ambulatory EEG we just heard from JT and Dr. Bell. That is a game changer for sure. Now, that's not the only treatment offered here at Neurological Care Center. Tell me about the EMG and the VNS. What are they and who are they for?
Sure. The EMG is the electromyogram. That's to diagnose muscle and nerve disorders.
Okay.
Anyone with low back pain, tingling, numbness in their arms, legs, hands, feet, any symptoms where they're having neck pain, this can help with diagnosing what the problem is, if they have nerve damage or not contributing to that problem.
Wow, so people with like restless leg and stuff like that?
Restless leg
Okay.
is something that we can also evaluate, yes.
Awesome,
Because
perfect.
very often people with restless leg will say they're having tingling.
Right.
And so we can evaluate the tingling and see if nerve problems are attributing to
Okay,
that.
all right. And then the VNS, what is that?
VNS, this is a very exciting modality that we have here. It's a vagal nerve stimulator. This is a device that we implant for persons with intractable seizures that don't respond to medication.
Okay.
Over 30% of people with epilepsy and seizures will never respond to medication.
Wow.
And it's very important to stop their seizures, because we've learned that if we don't stop seizures, that they can get brain damage, they're more likely to die from symptoms associated with having seizures. So this device is inserted and it's attached to the vagus nerve. It upregulates neurotransmitters and it helps reduce seizures, stop seizures in many cases. It also can auto-regulate when a person is having a certain type of seizure.
Wow.
And it will give an impulse to stop that seizure. The person also has a magnet that they can wear on their wrist. If they get an aura, this very often happens in people with complex partial seizures. That's this warning that the seizure is about to come on. They can swipe it and stop their seizures in their tracks.
Wow, that is absolutely amazing. Absolutely. Make sure you check out the website. It's right there on the screen, and get more information. We'll be back in just a minute.
What if you really could have it all?
At Exit Realty,
We believe in making dreams.
come true.
We believe
We believe the home you want
is right there.
is right there.
And we'll help you find it.
Thoroughly trained, passionately committed
And always on your side. You can count on us.
every step of the way. And you thought we just sold real estate.
We are Exit Realty. Think smart.
Think Exit.
Hi, I'm Dr. Rosa Bell, a board-certified neurologist and clinical neurophysiologist here at the Neurological Care Center. If you're having neurological complaints of headaches, migraines, syncope, neck pain, low back pain, or if you are in need for our cutting-edge procedure, the prolonged ambulatory video EEG, we can be of assistance. Speak with your physician and please call us at 334-262-1113.
Welcome back, and thanks for joining us. We're trying to inform and entertain at the same time, and trying to get you towards a healthier lifestyle. And there is a new supplement that's on the market that has actually been developed by Dr. Bell and her team, called Fiber Torch. This is an all-natural supplement. I've used it myself with some fantastic results. I know some other celebrities like John Tesh and Steve Harvey, several of my peers in the radio business, have also used Fiber Torch and give it raving reviews. So Dr. Bell, let's talk a little bit about Fiber Torch and the ingredients that are in this all-natural supplement.
Sure, JT. I'm very excited to talk about Fiber Torch. It was 5 years in the making. It is apple cider vinegar based. And what studies have shown is apple cider vinegar helps with making the body alkalinic. And when the body is alkalinic, this helps turn off cancer genes.
Wow.
Also, it is the skin, hull, and seeds of fruits and vegetables. This is all insoluble fiber, no carbs, and this insoluble fiber helps with GI motility. It also helps with increasing the metabolic rate.
I've heard so many positive things about the effects of anything that is apple cider vinegar based. It has really a tremendous amount of benefits.
Yes, yes. As I said, turning off cancer genes. Also, the body alkalinity helps with what we found anecdotally with decreasing the blood sugar, decreasing the blood pressure, and helping people with symptoms with arthritis.
That's wonderful. So joint pain relieved as well. And let's talk about the cholesterol levels. It also helps with that. Is that right?
Yes, we found that also. My colleagues, specifically Dr. Gore and Dr. Adams, have had this reported by many of their patients, as have I.
And while it's not specifically a weight loss product, it does sort of lead to side effects of a possible weight loss too.
Yes, that's been very exciting.
Yeah.
Several users, including myself, we have had weight loss, yes. And so that is part of the insoluble fiber and also the increased metabolic rate.
One other benefit we want to bring out about a fiber torch real quickly is that patients who are on opioid-based medications sometimes suffer from constipation. It's a side effect of the medication, of course. Fiber torch actually helps alleviate that.
Yes, it does, JT. Many patients, majority, do suffer with constipation with opioids. Fiber torch is an all-natural way to help with the constipation, and it does not decrease the effectiveness of the drug. Many of the drugs that are used for opioid-induced constipation do.
It's an awesome supplement. We're about to tell you where you can get this supplement online and around the river region, but let's talk about how it's consumed. How do you use Fiber Torch?
It's very simple to take. It is 2 heaping tablespoons. It's relish consistency. You follow that with 8 ounces of water and wait 15 minutes to eat first thing in the morning. And what you will realize is you feel very full, and the amount that you consume will definitely decrease.
Absolutely. So where can our viewers get a hold of Fiber Torch and learn more about the product?
They can go to our website and order, www.fibertorch.com. They can also get it from my office, Dr. Kennard Adams' office, Dr. Myrtle Gore's office, or Dr. Johnny Strickland's office.
And you know, I've talked to some of those doctors that you just mentioned, and it's so exciting too to not only hear it from you and your patients, but those doctors are prescribing it to their patients, and they're coming back for more because the benefits are just exponential compared to what they thought they would be.
Exactly. We have a lot of repeat users.
Yeah, absolutely. Fibertorch.com for more info on the all-natural supplement Fiber Torch developed by Dr. Bell. We appreciate you joining us, and we're back in just a moment.
Thank you.
At Newks Eatery, we think tonight's dinner should be extraordinary. Your favorite hand-rolled pizzas, signature salads tossed just for you, sandwiches built from scratch, robust kettle-simmered soups, and Newks' own incredible baked desserts. No white tablecloth required. Just bring your appetite. Join us tonight at Newks Eatery.
Located in Montgomery, Auburn, and Opelika.
Spring is finally in the air and beach fever is at its peak. To help you get through it, the Holiday Inn Resort on beautiful Panama City Beach is offering you great spring specials like our buy 3 get 1 free special with all the same great entertainment, warm days, cool nights, and some of the best rates of the year. Now is the time to visit the Holiday Inn Resort. Come see why so many of our neighbors call it their home away from home. For more details or to see all of our spring specials, please visit hipcbeach.com/spring.
Dr. Bell, thank you so much for taking the time out of your busy schedule and joining us today and allowing us to just answer questions and talk to you about the different procedures and treatments that you provide here at Neurological Care Center. Now, I do have a question for you. So, as we recap, because we have given so much information, what are your top 2 reasons people come to see you?
I would say my top 2 are migraine headaches and seizures.
Now, like I said before earlier, I suffer from migraines, and I know sometimes you can go see a doctor and you can get medicine, and sometimes that works and sometimes it doesn't, and sometimes those migraine medicines are really, really expensive. So you offer a different way to treat migraines.
Yes. First and foremost, we determine if it is a migraine, and we give several treatment options other than medication for treatment of migraines.
Well, you know, in this day and age of opioid medicine and stuff like that, I am all about trying different ways outside of medicine to be treated for migraines and seizures. And we so appreciate everything that you have talked about, and we want to make sure that people know how to get a hold of you and your website so they can definitely reach out. And if they know someone in their family or them themselves want to get a hold of you, so how can they do that?
Sure. They can call my office at 334-262-1113, and we've made it very easy for you to get in touch with us with our website, drbell.net.
Awesome. We appreciate you so much. On behalf of JT and myself, thank you for joining us today from the Neurological Care Center next to Jackson on Mulberry and Montgomery. And thank you again for taking the time. I know you're super busy.
Thank you for having me.